we speak about alopecia, it's a whole world of procedures that we can work on, surgicals and non-surgicals. Usually, when a patient comes to us asking for a hair transplant, it's because they have lost hair density in a certain area, usually on the scalp, or can be also a loss of hair density on the beard or on the eyebrows. What do we offer? We offer to repopulate the area. We usually take hairs from the occipital part or back part and bring them to the area that needs more density of hairs. And why do we take the hair follicles from the occipital area? Because in this area, the back part of your head, usually we have the correct genetic information. Haven't you seen a bald patient on the street? Usually they have some hair back here. Nothing up here, but some hair back here. Because in this area, we are born with the correct genetic information. We have some receptors for a specific hormone that is called the hydrotestosterone that are located usually in this area of the scalp. That's why we start to lose density in this area of the scalp. That usually is not exactly the same, the baldness or the alopecia area in every patient. Some patients will have a front line that goes back, some will have side recesses, some will have a crown area without hairs, or a combination of any of those. Because the alopecia effect is different and it comes individually in each patient. No two patients have the same kind of baldness or of alopecia in their scalp. So again, what we will do to repopulate an area with a low density of hairs would be a hair transplant. Usually it's a very easy-going procedure with a very quick recovery time. We will have some scabs on the back part of the scalp that will fall between 3 to 4 days. During the surgery, we will take one hair at a time from this area and put it on the front area where you need more density, so it will have a totally natural look. It's an FUE type of micro transplant. We take one hair at a time and we put back one hair at a time for a natural appearance. It's important here to know that we do more than just the surgery. We offer a whole bunch of different procedures, including different technologies as lasers and others, and also medications and some lotions that should be applied on the area of the alopecia. Because remember, we cannot cure the alopecia itself. We put more hairs where you have low density that will not fall in time, but the ones that come with the incorrect genetic information will keep on falling in time. And those hairs are the ones that we treat with the non-surgical options, the ones that we keep, the ones that we want to keep as long as we can on your scalp. Remember, a micro hair transplant is not only for the scalp, it can be used also in the eyebrows and in the beard to increase density or give a better definition. So if you have any questions regarding alopecia or regarding a hair transplant, please do not doubt in contacting us. We will be delighted to help you in your alopecia process.